Before watching this video, click on the subscribe button.
Assalamualaikum. Today I have the syrup to review. Is the Babynol syrup 60 ml honey flavor खुश्क खांसी के लिए मौसर दवा एंटी ट्यूसिव. So Babynol syrup, and now I am going to read about the further information. Okay, so just go for the composition. So each 5 ml contains chlorampheniramine maleate, 1 milligram dextromethorphan. HBr is about 7 mg, and dosage for the age group under 2 years. Children under 2 years, consult a doctor. 2 to 6 years, 1 teaspoonful. 6 to 12 years, 2 teaspoonful. Adults and children above 12 years, 2 to 4 teaspoonful. The dose may be repeated every 6 to 8 hours or as directed by the physician. Now I am going to read the caution. Okay. Babynol should be given with care to patients with liver disease and asthma. Store below 30 degrees centigrade. Protect from sunlight and moisture. Keep all medicines out of reach of the children. Out of the reach of children. Do not exceed the stated dose. May cause drowsiness. Hence, if used by adults, do not drive or operate machinery while using Babynol. To be sold on prescription of a registered medical practitioner only. सेम इंफॉर्मेशन यहाँ दी गई है उर्दू लैंग्वेज में. उम्र और खुराक हर 6 से 8 घंटे बाद जो है वो आपको डोज रिपीट करनी है. दवा को 30 सेंटीग्रेड से कम दर्जे हरारत पर रखें. And the company information is given here. Okay, and now I'm going to give you the quick review about Babynol syrup. हम क्यों यूज़ करते हैं Babynol syrup? So Babynol cough 60 ml syrup suspension is a helpful and effective medicine for the treatment of throat irritation and sneezing. It is helpful medicine for colds and coughs. Babynol cough 60 ml syrup suspension contains 2 drug as active ingredients and gets rid of symptoms of runny nose, sneezing and cough. How effective is Babynol cough syrup 60 ml? Babynol cough 60 ml syrup suspension is used for the treatment of different cough and common cold symptoms. It contains dextromethorphan and chlorampheniramine maleate is the active ingredient. Dextromethorphan is known as a medicine. Dextromethorphan is known as a medicine that belongs to the group of medicines known as cough suppressant. It works by suppressing cough. And second component of Babynol cough 60 ml, chlorampheniramine maleate, is an antihistamine that works by removing allergy symptoms. It actually blocks the effects of a certain chemical found in the body known as histamine. The mechanism action of chlorampheniramine maleate allows the human body to get rid of allergy symptoms. Okay. सो डजेज की बात हम कर चुके हैं. So I am going to talk about some side effects. Babynol Cuff 60 ml may cause some side effects, but they are extremely rare. Side effects can include blurred vision, slow breathing, drowsiness, dizziness, vomiting, while some severe side effects including difficulty in urinating, shaking, and unsteady walk. Babynol Cuff 60 ml warnings include that first of all, you should share your medical history with the doctor before using Babynol Cuff 60 ml. Inform your doctor if you are allergic to any of the ingredients. Consult to your doctor before using Babynol Cuff 60 ml if you are pregnant or breastfeeding. So, guys, I have done my review about the Babynol syrup. ये जो है वो यूज़ किया जाता है कफ, खांसी और जो है इफ़ेक्टिव मेडिसिन है थ्रोट की इरिटेशन में, स्नीजिंग वगैरह में, यानी कि सारे कोल्ड और कफ के सिम्टम्स में. सो प्लीज़ कंसल्ट योर डॉक्टर बिफोर यूजिंग एनी मेडिसिन. So if you like my video, so don't forget to click on the subscribe and share button. Thank you so much.